I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
So today, this young man, he's from DC, and I did his gyno about a year ago, and he's got great results. We'll get you his pre-ops. I'll look at your pre-ops. We'll get you. So I just did his gyno back then. When I did it, I didn't. Did I make a hole here? I did. Okay. So I got a little bit of a six-pack, which he looks great. But now, make a muscle. He looks amazing. That looks great. He's got a little scar tissue right here that if I wasn't doing something else on him, I would give him a little steroid shot. But since I am doing, he wants his abdomen, flanks, and back done, I'll do a little touch-up to kind of get this better. And maybe a little bit over here, get that better. But he looks amazing. Not overdone. Lift up your arms. See, no indentation whatsoever. Make a muscle. See, that is perfect. That's the pec muscle. Not really overdone. Again, I see a little bit over here that I'm going to touch him up. But anyway, and I see a little bit of a six-pack because I did give him a little. He heals great. Everybody's worried about scarring. He's got an semblance of a six-pack, but I'm going to even do him more. I'm going to scoot down, get all of this done. Stealth incision in the groin. Here, make another one here so I can get even this better. One over here. One in the back so I can get his back here. All of this done. So one over here. I may not even put one here because he looks really good here. I may just put one here. This is really nothing much here to get that. I think maybe even save that. Put one here to get this better, and put one here to get that better. His lats are great. Make a muscle with your lats. Yeah, nice wide chest. I mean, he can cut down his fat intake and his carbs and stuff a little bit to enhance him a little bit. But he with our American diet and food and work and stuff, we eat Popeyes and
Chipotle.
Chipotle is actually good. Popeyes and what else did he say?
Everything.
And everything. So anyway, he's gonna eat better, but I'm gonna really get him up. Now, do you want a six-pack? Do you want real six-pack? Do you want to be flat, or you want that nice six-pack going on?
I definitely want the six-pack.
All right, so I'm not going to do much. I'm not going to do much to any liposuctioning here. I'm going to make an incision here to get the midline, and I may do one over here just to get this one here, and this one I can get by my curved cannulus here.
Okay.
Get this semilunaris here, suck in your belly. See, that semilunaris right here, all the way down. Get that nice V shape on him. Empty this space because you don't have a six-pack beyond here. Do a little bit more core work, but he's got some fat there. He's got the lateral blikes here. He's got some fat here, but I'm gonna scope below it and scoop above it and get all the way here. He's gonna look amazing. And again, all the way back here. Get all this done here. Make his butt look a little bit bigger. He's got great lats. We don't have to touch that up there. All under local anesthesia. So I'm going to mark them, numb them, and to the OR. So this is beyond gynecomastia. We did them. I'm going to do a little touch-up. Now I'm doing his whole body, abdomen, flanks, and back. So let's go. So here we go with my markings. I'm going to do minimal liposuction here because I want to maintain the volume of fat here because he wants a six-pack. So if I flatten this out and do the negative spaces, it's not going to have the shadows and highlights that I want. So I'm going to resist the temptation to do liposuctioning here, but then really liposuction in the linea alba, the midline, and then the semilunaris down. Get that nice V shape. This is the lateral blikes here, right here. Keep that. I want to just do those lateral above that right here. And same thing over here. Those are those lateral blikes. But here, no matter what, I want this down because guys just want to be flat elsewhere, flat here, maintain volume there, flat here, and flat there. So the six-pack here, touch them up here, empty the space, lateral blikes, it's a lot of chub here, even though there's muscle here. Empty the space over here, way on the back, come over here, and empty the space all the way here to show off better the lats right here. Make a muscle with your back. There you go. I mean, there's no fat there. That looks amazing. And empty the space really nice. Give them these venous dimples right there. I'm not going to make an incision there because this is empty, but through my incision laterally with my curved cannulas, I can get these venous dimples right here. So come on over here. So let's take a look and let's numb them in my stealth incisions and let's get going. We pump you up.
Pump you up.
So we are vasering in the incision in the groin, going across. This square, I want to just absolutely melt. Make it flat. So we suck you out.
Here to suck you out.
So I remarked them. The anatomy is so important. I've been using this for about 6 months. It's helium gas with a freaking flame at the tip, right like that. So now he's laying on his side. This is his back, and I'm doing his flanks. Okay, so I'm really scooping this. So that's his butt over here, and I'm scooping this really nicely. Already did his belly, so I'm doing this flank, which is his left flank, and the back going down here. That's his spine. All right, so here we go on this flank. We are vasering. Right. Melting this flank, which is like chest fat, it's resistant to diet and exercise. So now how much you exercise, very tough to get rid of this flank fat. So I did his gynecomastia surgery about a year ago. He looked great, he was thrilled, he was happy, it was perfect. And he actually went to me and he said, Doc, I want to do the rest of my belly and my flanks and my back. So we did Vaser Hi-Definition Power X Liposculpture of his, we actually redid the whole thing. I touched up the chest because I'm gonna do it right. So I touched up the chest, did the semilunaris over here, did the midline. I made 2 little incisions here. That's going to drain by himself to get the 6-pack, 2, 4, 6. These are little drains that are just going to drain out into gauze in the belly button and in the groin, and that is going to drain out in a couple days before he goes back home to Washington, D.C. I will drain this out. I sculpted them all the way back here, No glands because there weren't any more glands from the previous operation. These incisions are going to heal great. The one by the nipples is going to heal great, and this in his groin is going to heal great. I did one in the back here, which is also going to heal amazing. But now suck in your belly. You get that nice line here, the hint of the six-pack. He's got fluid in him, so he's still swollen. But in the next couple of days, when the swelling goes down, he's going to look and feel amazing. So if you have gynecomastia, and if you have gynecomastia and you want your whole body, call me, Dr. Lebowitz, 631-424-0101, 631-424-0101. Thank you, and see you soon.